Hello everyone and welcome to Meet the Experts. I'm Dori Soukup and with me today is my special guest, Miss Jordan Jacobs, and she is with the Medical Artistry in New York City. She's about to publish a brand new book and she's here today to share with you all sorts of information about how to navigate through the aesthetic world, so to make sure you are getting the best treatments and you are fully informed on how to actually choose the right person to go for your aesthetic treatments. So stay tuned and we'll be back with you in just a moment. Welcome back. Here we are. We're about to start with Miss Jordan Jacobs. Welcome, Jordan. It's so great to see you here today.
So great to be here. Thank you for having me.
I am so excited for our audience because I know you have so much information to share. And truly, the reason we wanted to do these shows is to inform the audience on what is myth, what is reality, what is good, what is bad. I feel there's so many mixed messages out there. And that's why my goal for the Meet the Experts is to bring on people like yourself so people can navigate all the myth and realities in this world that everybody wants to be part of.
Absolutely.
So I'm so excited.
Yeah.
I know you have a new book coming out and it's called Poke Me Pretty. I love the title, by the way. Your Guide for Non-Surgical Aesthetics, Aesthetic Injections. So what drove you to actually write a book?
There's just so much misinformation out there, and whenever my clients come to me, they have so many questions and fears that I have to debunk and really tell them what reality is. And I think that there's so much you can do with aesthetics. You can get surgical results without surgery, and it's incredible because it's not only making people look better, it's actually making them feel better from the inside.
Very true.
Yeah.
Very true. So we want to start. When I heard your story, I was amazed of the things that you actually went through and what you navigated to get to where you are now. You have a successful practice. You have clients that come and see you from all over New York. That says a lot about your accomplishments, not only from the aesthetic standpoint, but navigating through life. Let's start by sharing with everyone a little bit about your story, because I think it's truly inspiring for so many young females out there, or even males, on how you can overcome so many obstacles and be as successful as you are now.
Thank you. Thank you. So I grew up in Austin, Texas by a single mother, and right when I turned 18, I moved up to New York City. It was always my dream to live in New York. I had not been there, but it was just in my mind. It was just something I knew I had to do. So I moved up to New York in 2009, started going to school. I was in a PA program, actually. And the first semester in, I got kicked out of the program with a 1.6 GPA. So
Because you were having too much fun.
yeah, I was not focused on the right things. So that was tragic for me. That was my ticket to New York City, and without being in the program, I had no reason to be there anymore.
Right.
So I ended up going into bartending after I got kicked out of school, and my life just spiraled downward at that point. I was surrounded by toxic people, like drugs, alcohol, just gangs. Like, it was not a good crowd to be around. And before I knew it, I was actually in an abusive relationship that I had gotten stuck in. And I ended up giving birth to my first daughter, Scarlett, when I was 22 years old.
I love that name, Scarlett.
Thank you. Yeah, she's actually a twin. I lost her identical twin sister during the pregnancy. It was a really hard time. And Scarlett had heart surgery just a month after her birth. But after we got through all of that, I knew that I needed to have a beautiful life for my daughter and I. So I looked back into school and I applied to nursing school and I got in, and that gave me hope again. So I ended up going through school as a single mother, and I had left the abusive relationship, and I was on like food stamps and just really hard time being successful alone in New York City. All my family was in Austin. I don't know how I did
That
it.
takes a lot of courage.
Oh, and by the way, I gave birth to my second daughter in nursing school. So, yeah, I
were juggling a lot of balls.
I was juggling a lot, yeah, and thank God I didn't get kicked out of nursing school. I was so close to getting kicked out, but I made it through, and then I became a nurse. And right out of nursing school, I got hired by Dr. David Funt, a well-known plastic surgeon in New York City, and he taught me everything I knew.
Nice.
Yeah.
So he was like a mentor for you
Yeah.
to actually guide you and take you from the path that you were going down on and got you in the right direction to where you are now, really.
Yeah. Yeah, I thank him all the time. Without him, I would not be here
amazing.
today.
Yeah. So let's talk a little bit about your aesthetic. So he started teaching you all these things. And now you have such a huge success. You're all over Instagram. People come to you from all over. By the way, if you want to check out Jordan's Instagram, it's Genuine Injector.
Yes, Genuine
handle.
Injector.
So if you'd like to go and check that out and see all the great work that she does. So today we're going to be talking about all the different treatments that you actually do. So from that, from him teaching you to where you are now, we're talking about a lot of experience, a lot of learning. What drove you? What was the passion that was driving you to wanting to be the best that you are now?
My daughters, it always comes down to my daughters, because I want to provide a beautiful life for them. And as Dr. Funt's nurse, I was incredibly happy working under him, but I realized that there was a limitation to my revenue, and also and also being there for my daughters. I was his only nurse, so I'd have to wake up early and stay late to take care of OR patients, and it just wasn't the ideal life that I wanted for me and my daughters. I wanted to be there for them and attend like school plays and stuff. So, you know, as a single mother, it's hard to balance the two, your career and being there for your children. And my children will always be what I value the most. So going back to that, that's what really motivated me to take the next step and become the best injector that I can be today. I reached out to more mentors overseas. I went to conferences constantly online and like teaching myself new techniques because I wanted to be on my own and I wanted to be known as an expert.
Well, you are. You have come a long way, and your story is just so inspiring, I think, to so many people that might be where you were, and now you are in a totally different way, enjoying your success and your expertise and helping so many people, like you said, look absolutely amazing. So let's start talking a little bit about the different types of treatments that you actually do in your place. And let's start with the face, and then we'll move down to the body, because I'm sure a lot of people want to know exactly what's out there. How can you address certain problems that people are having? So let's start with the typical person that comes to your practice. What is the first thing that usually they express as things they don't like about their face? And what are some of those solutions that you actually offer for them?
There are three main things that people come to me for. The first one is lines on their forehead. The second one is lips. And the third one is under eye, dark circles or hollowness under their eyes.
Yeah.
And oftentimes it's one thing that sticks out to them, but there are many other things that also bother them that they just don't know how to explain. Express to me.
Yeah.
So I have a wide age range of patients. The youngest I've treated is 17 years old. The oldest I've treated is in her older 80s or later 80s. Yeah. So, and I also treat men.
Yes. Yeah. Very nice. Okay. What I love about what you do, because you consider yourself an artist, and I think that's one thing when people go to an injector, I find sometimes they miss the whole look. They may do a little bit of Botox. They may do a little bit of this and that. But you, from what I've learned about what you do, you actually look at the entire face. And like you just mentioned, they may not know some other things that they need. So take me through the process. If I came to you as a patient or a guest, what would you do? How does the artistry in you come out to truly help them look absolutely their best?
So before I tell you about the consultation, let me just tell you about medical artistry a little bit. Okay. Medical, it covers the theory, it covers the science, the behavior, the rheology, the like what goes into knowing the products, the anatomy and physiology. There's that aspect of the business, but then there's also the artistry aspect, which focuses on the artistic eye and the artistic hand and being able to visualize a plan and having that vision and taking everything and putting it all together and customizing it for that person. Yes. So that you can have a really great medical professional, but they may not be an artist, or it could be the opposite. They might be an artist, but they don't know the science behind it. And so it takes that perfect balance to have a really good injector.
Nice.
So if you were my client and you were coming into my office, I would first take your pictures. We would take comprehensive pictures and videos. For Botox, I have to see expressions, dynamic photos. That means like scrunching your face together, lifting up your eyebrows, making a baby face, and all these things. It's really awkward, but
it's fun. It's like doing all kinds of little faces.
So yeah, and then I get those photos and we pull them up on a big screen like this, and we review them together. We look at the videos, we look at different angles of your face, and this supplies an objective view for the client and myself to go over together, so we can actually point out what I see and what they see and kind of come to an agreement on what needs to be the priority or the focus of that session.
Love that.
Sometimes there's only one thing they want to talk about, and if that's the case, I don't push them to talk about other things because it can be very overwhelming for someone. Other times they want to hear my expert advice and they want to hear every single thing that I would do to them or for them. Yeah. And that starts from the very top of the head to the feet. Yeah. You know, there's a solution for almost everything now.
Yes. So let's talk a little about those solutions. Let's start with the forehead and move our way down. Okay. So what are some of the things now? I know simple Botox, yes, but what other things between the temple and the forehead that you can do for someone?
Well, we can actually start off with the hair.
Okay, let's start with the hair.
We could do something called PRP, platelet-rich plasma, to stimulate hair growth or strengthen the hair. You can also put Botox in there to help stimulate hair growth and treat migraines. Yes. Going down to the forehead, we can do fillers, Botox, or thread lifting for fine lines and wrinkles. Or if you have a masculine shaped forehead, as a woman, you can put filler in there to kind of plump out the forehead and round it out to give you a more feminine shaped forehead. Have you ever had like a woman you've seen that's beautiful, but she has like a square forehead?
Yeah, or like very back also like hairline, which makes also the forehead more manly.
Yes, yes. So that's great for them. Going down into the temples, you can put fillers there. As we age, the temples start to hollow out, and it can really give away your age. Yeah. You can also use that area as a brow lift, or for thread lifts, people are putting threads down the hairline into the brow to lift up the brow, and they're calling it the fox eye lift. That's trending right now. And then going down to the brows, we can do a brow lift with the combination of the three. We could do glabella treatments, which is the area in between the brows, to get lines or to lift that area as well. We can do above the eyes with fillers. I can do an eyelid lift with Botox.
Wow.
Yeah, it's crazy. Like, you might not need surgery.
Right.
Yeah.
Well, that's what you're doing, is you're delaying the surgery.
Yeah, you're delaying
with those non-invasive great treatments by poking them.
Exactly. But I'm pro-surgery. I am pro plastic surgery.
Yes.
I've had many surgeries myself. I just had my eyes done and breasts done like 4 months ago. So like if I think that you need surgery, I'll tell you.
Yeah. Because there's only so much you can do with non-invasive treatments, and then it's a nice combination if they want to go there.
Exactly.
Yeah.
Yeah.
Let's talk a little bit about threads. I know you mentioned them for that, but I know you are like a super expert with the lift in the face.
Yeah.
Tell everybody, because I think a lot of people are probably still hesitant because the threads are so popular in other countries actually, but in the US, I feel like now more and more people are being aware of them and what they can really do to your appearance. So talk about that a little bit.
I love threads. I'm obsessed with threads. So what they are is they're a surgical suture made out of sugar or polymers, and they just go right beneath the skin and they suspend that area. So there are different types of threads to choose from, depending on what they're made out of. There's PDOs, PLLAs, and PCAs, or not PCAs, PCLs. Sorry, I always say
That's
PCA.
okay. Can you repeat it one more time?
Yeah. So there are different types of threads to choose from, and they're all made out of different things. There's PDO threads, PLLA threads, and PCL threads.
Okay.
The difference.
I have no idea what that is.
They're all polymers, and they're materials that they use to make sutures and surgeries. So they all behave a little differently. The PDO threads give you the most lift. That's the ones that I most.
That's the one I'm familiar with.
Yeah, that's the one that I most commonly use. They're more affordable, and they give you the most lift.
Okay.
The PLLA threads are actually made out of the same material that Sculptra is made out of.
Okay.
Have you heard of
Yes.
Sculptra before? Yeah, so it's a filler. It's a biostimulatory filler. So it adds volume to the face in the areas that you use it in, or the body if you're using it on the body. The PCL threads give you a little bit of the lift and the filling component together, so it's kind of in between, but it lasts the longest out of all of them.
Okay.
So depending on what your goal is, would determine the material that you're using. And then aside from that, there are barbed threads, twisted threads, and smooth threads. So I select that depending on what I'm actually trying to do.
Okay.
If I'm trying to lift something, I'm going to use a barbed thread. The thread has little barbs on it, and it catches on to the tissue, and by pulling it back, it suspends the area. The twisted threads have a little twist of suture around it, and it just stimulates collagen.
Okay.
So that's really good for like acne scars, or if you want to put it on the border of the lips to add a little volume and define the area. And then there are smooth threads, which are just a straight thread that also stimulate collagen, and I usually put them in meshes like this to strengthen the area and create collagen meshes.
And literally, this is almost like a mini facelift, right?
It
so
is.
You're really lifting everything up.
Yeah, it is. So I call it a non-surgical facelift, or a non-surgical neck lift, or a breast lift, or an arm lift. And it's really effective.
Yeah.
You really get surgical results in 30
That's
minutes.
amazing. It's just amazing.
It is.
Let's talk a little bit about the actual feeling, the experience that I would have, because I am very fearful about things. I'm a wimp.
I know.
So how do you actually convince someone, or how much pain is someone going to go through? What's the experience like of threads?
So I've done thread lifts myself 3 times so far, and I can tell you it's really not that bad. Like the pictures look way worse than the actual procedure itself. It's not that bad. I'd say it's like a 6 at most, or maybe a 7 here and there. But I numb the area with lidocaine, with injectable lidocaine, and I just put it at the entry point, and then I make a little hole, and I attach the lidocaine to the end of the thread. So as I'm pushing the thread through your skin, I can squirt a little lidocaine with it, and it completely numbs the entire area. And it's done, I can get it done in 15 minutes, really.
Wow.
It's really fast.
Yeah. That's amazing.
It is. it's worth it.
So when you're doing the whole facial profile with someone, trying to paint a picture of what all these treatments combined will do, it's amazing. It's like total transformation.
It is, yeah. I mean,
people.
there's so many solutions that I have to offer that literally, if you gave me your issue, I would have a list of things that we could do to
Options.
solve that issue.
Yeah. So now, if somebody is, let's say you do the threads, but they have a lot of hollow area, like when you start getting older, you're in your 40s, your 50s, your 60s. So multiple treatments would be more of a way to achieve the best results. So are you big on combining different treatments together to get the best results?
Yes, absolutely. Yes. I oftentimes combine the three together: the thread lifting, the Botox, the fillers, PRP, skincare, and then also just knowing that it takes time and being willing to go through that process and that journey, because these things don't happen overnight.
Right.
Although you do see results immediately, it's really like a month or 2 months down the road, once it really settles in, that you see the final result.
Yeah. And what I love about the threads, they're so natural looking, right?
Yeah.
Because you're not, even if you just did them by themselves, they give you that natural look. And then if you're adding the other modalities to it, then you're even enhancing that much further.
Yeah, that's what I really love about threads too, is that you're not adding anything to their face. You're not adding volume. You're just lifting what was already there. So yes, it's going to give you a surgical result, but you don't really have to worry about looking weird like with fillers, whenever you see an overfilled face or they start to look like an alien or something. That's not
like
really
a blow up fish.
Yeah. Or a duck.
Yeah.
Or Frankenstein or whatever it is. Yeah.
Well, I think that's the big fear we hear from consumers, is they want to look natural, but they want to look fresh. They want to look glowing. So that's really what they're going for.
Yeah.
But sometimes what happens, from what I hear, is they fix one thing, but then you realize you need to keep going to make that nice, complete look. So I know you do things for, like, once you lift, sometimes you have to adjust the jawline or the chin area. Can we talk a little bit about how you actually move down the face, and how do you actually figure out what is the best look for that person? What are the options?
Yeah, definitely. Well, as far as like the fear of overdoing, or maybe I'll get addicted to it, yes, that's like a reasonable fear, but these things can also be done in a way that's very subtle, so that you don't feel like you have to keep doing things, such as the Botox. I can put a very small dose in there so that you still do have lines whenever you move. It's not completely frozen.
Which I like,
Yeah, and there are a lot of New Yorkers who like to still have lines on their face. They don't want that frozen look.
Yeah, because you still want to look natural.
Right.
Yeah, I'm one of those people.
Yeah. Yeah, and it's achievable. So if I'm moving down the face, we all age similarly. Our mid face starts to sag with gravity, with time, with deterioration.
Tell me about it.
And there are fat pads that sit in our face that start to slide down the face, and they become jowls, and you lose the definition in your profile view, and you start to get a double chin. And it's not because you're fat, it's just because things are becoming lax and gravity is weighing on us. We don't live in outer space. I wish we did.
Yes, gravity is a terrible thing as you start aging, for sure.
Yeah. So it's natural for all of us to age similarly, in that, the way I approach people is pretty similar. But I also am able to look at them and see what makes more sense for their face. I don't do a cookie cutter consultation with people. I listen to what their concerns are, what their priorities are, and then we work with that. So oftentimes with the mid face, we can do either fillers or threads to lift the fat pad that has fallen. Because this line starts to get deeper, and we start to get jowls. Right?
You're looking at them. I can tell she wants to actually start working on my face right now. She's checking me out, and she's like, "Oh, Dori, you need some help."
No comment, no comment. But I mean that is something that I do. I'm constantly analyzing people's faces.
So what can you do for the jawline?
The jawline. So we can melt away that jowl pad because it's a fat pad here. And there's something called deoxycholic acid, also known as Kybella.
Okay.
You just squirt that in there and it literally burns away fat. It melts it away permanently.
Wow.
So I can burn this jowl away. And then once that's gone, I'm left with a little leftover skin to lift.
Yes.
We can either lift it with fillers or with threads. If you need volume in your face, then we're going to put fillers. If you need to lift without the volume, then we'll do it with threads.
I see.
Or we might do both, right?
Yeah.
I can also tighten the jawline with Botox. We can put Botox all around here, also called the Nefertiti lifts. And that's going to lift the entire lower face, including the neck.
Yeah. Okay. Very nice.
Yeah.
You just sculpted the whole face.
I have
Let's
more
talk
in
about
here
the
too.
lips now. Let's talk about the lips. Lips are probably one of my biggest pet peeves when I look at people sometimes, and there are so many bad lips out there. There are really a lot. You have the most beautiful lips, I have to say. You do.
Thank you.
So how do you stop people from, and you even called it something which I think is so it's so funny, but how do you make sure that people don't get too carried away with their lips, because they may want that, but like, how do you advise them, like, no, you don't want that, or do you just give them what they want? How do you?
I never give. I mean, I do give people what they want, but it has to be within my aesthetic realm.
Because it's your signature on it. Like the last thing you want.
I'm branding people with Jordan Jacobs.
Exactly.
Like, if you look bad, that's a reflection on me. And it's hard taking clients who have seen other injectors who have had bad work done, and then they want me to add on top of that. It's really hard for me to handle that because it has to be dissolved.
Yes.
And a lot of people don't like going through that dissolving stage of being deflated or
deflated
or lopsided. And oftentimes that happens with the lips.
Yes.
They were poorly injected, overfilled. They have leftover fillers that have been there for years. It's gone over the lip. They have that ducky look, and it just has to be taken out.
You probably correct a lot of people's mistakes.
I do.
Take it.
Yeah.
And the lips are like the first thing you really notice because they're like out there.
Yeah.
To correct them is probably truly an art.
Yeah, it's difficult. And like you said, they're right in the middle of the face. They're supposed to have symmetry. They're supposed to be like a hallmark of beauty. And when they're ugly, then it really can mess up someone's face.
Well, see, the one mistake I find in talking to consumers is a lot of times they're trying to find the proper injector for them, and it's sad to me, but I hear that they choose a place just based on price rather than expertise. And that's really why I like bringing on experts like you, because to me, it's all about who's going to be working on my face and giving me the best look possible.
Yeah, and it can be from both spectrums. There are deal seekers out there who try to get Groupon lips and it doesn't work out.
Yeah.
And then there are also people who go to the most well-known, most expensive doctors they can find, and they also get bad outcomes. So, you know, I'm somewhere in the middle. I charge between $750 to $950 for my lips in New York City, which is pretty reasonable. And I've had clients who have done both, who have either had a bad experience with a cheap deal or they had a bad experience with a really well-known person. And it's always a huge disappointment and a trauma for them to get over, which is hard to work them out of and like earn that trust back from them.
For sure.
Yeah.
Then the other thing I want to help our audience with is you could have all these procedures done and you made a good investment in looking your best, but then you look at their texture of their skin or the actual quality of the skin itself. It's like you need to continue that process, right?
Yeah.
So what advice do you give people on maybe what they need to do at home so they make sure they have beautiful, glowing looking skin?
Yeah, well, I always relate the face or self-care to either a car or a house. When you're first getting a car or a house, you have to put down a big down payment. Getting the structural things the right way, it's going to take a huge investment. And then there's also the maintenance that you have to worry about. There's the daily maintenance of taking out the trash or putting in the gas, and then there's the quarterly maintenance of getting oil changes or, you know, changing out the gutters on the house.
Tires.
Yeah, and then there's the long-term maintenance of like changing the roof or the tires, like you said. So there are many things going on with the face and with your beauty that you have to consider, and skincare regimen is one of them. Having a good cleanser, RA cream, retinol, sunscreen, exfoliating, and then doing seasonal peels, you know, everything. It all matters, and I do everything.
Yeah.
Yeah.
And I think that's sometimes a missing part from most people, because after they make that investment, then they go to like a drugstore, Walgreens or CVS, and buy terrible products.
Yeah.
Terrible, yeah. Or Neutrogena.
Or the peach scrub or whatever it is.
Yeah. So I think it's important for everybody to know that you really need that whole complete program, so you can have, yes, the good structure, and then keep up with the feeling and the look of the skin itself.
Yeah, the tone, texture, and quality of the skin itself.
And the size of your pores and all those things.
Yes, definitely. And I usually tell people to talk to the esthetician that I work with on site. They are the skin experts. I'm not. I mean, I do have basic knowledge of that stuff, but I really rely on my estheticians to educate my clients with that. My specialty is the underlying layers of the skin. So that's the bone, the vascularity, the glands, the fat pads, and how to suspend it. And like, I see myself as an architect of the face. I'm building.
And that you are.
I am, yeah. Yeah, I'm building structures under your face.
Yes.
Yeah.
That's very important. That's why you're the artist.
Yes.
Perfect. So we just talked about the face. Before we move on to the body, are there other advice you'd like to give people concerning the face? What are some of the mistakes that you see people make? Or do they start too late? Or do they not seek help, you know, fast enough? Or how do you ever look at someone and say, I wish you would have come here like 5 years ago?
Definitely. Yeah. I think that a lot of consumers assume that they have to be a specific age to start these things, and that a certain age might be too young. But really, you start aging in your 20s. And if you start early, you can start small, and the investment is less than if you were to start in your late 40s or your 50s.
Yeah.
And it can be overwhelming for people whenever we have our consultation, and I give them a realistic expectation of how much it will cost or what all they really have to do to get to the end goal that they're seeking to get to. And for my younger patients who are in their 20s, it's not an overwhelming thing for them because they're starting young. Yeah,
very good. As far as them deciding, how would you say is the best way for someone to, now I know you're in New York City, so obviously if you're in New York City, she's your gal, but for people that are not in New York City, what advice would you give them on how to actually search and select that ideal person that they should go and trust their face with? I mean, that's a huge thing. What are some of the things that you think they should be looking for?
Well, just to let you know, I am certified in over 34 states, or
Woo-hoo!
34 states. So if you wanted me to travel to you, I possibly could. But what you should look for in your aesthetic injector is someone that actually listens to your concerns, because they could be great, but if you're telling them that you want something and they're not hearing you out, then you're not going to be happy. So someone who's listening to what your concerns are and what your priorities are, someone who has that artistic eye and hand, and then someone who is relatable, that you can trust, I think is really important, because whenever we talk to our injectors about our face or whatever our concerns are, it's really it's sacred.
It is.
It's
personal
really, it's deep.
and
It's
sacred,
personal. Yeah. And it oftentimes signifies something deeper. So having that trust is very important.
And the other thing I think would be huge is like an Instagram account where you have your before and after pictures, your case studies, like showing your work, right?
Yeah.
Showing how talented that person is.
Yeah. I mean, that is important, but again, some injectors are not good photographers, so unfortunately that's not always the way to find them. Or there are some very good photographers who know how to Photoshop their work.
Oh, okay.
But yeah.
So that's not a really, okay, well that's a great insight actually.
Yeah, it is, yeah.
So how do you know if someone is really good then?
Most of my clients are word of mouth.
There you go.
Yeah.
So referrals.
Yes.
Okay.
Yes.
Well, that's the best advice right there. That's good.
Thank
All right.
you.
So we just talked about the face. So we discussed Botox, fillers, threads. We didn't really talk about, let's move down to the neck now. And peels. You talked about peels and maybe even
PRP.
skincare, PRP. Yes. So now moving down to the neck.
Yeah.
Many people don't like that double, the turkey, what do they call it? The gobble.
There's so many names for the neck. The main two is a turkey neck. That's when you start to get that crepey, gobbly look right here.
It's like all of the sudden, it's like...
Yeah, and with Thanksgiving coming up.
Yeah, you know. Thanksgiving.
And then there's also the tech neck. So that's from all of us young people looking down at our phones all day.
Yeah.
And
they're getting all these lines.
These really deep necklace lines. Yeah, it's really becoming an issue. And with Zoom and FaceTime, we're noticing it even more. And we're seeing our double chins even more. So I had a client actually call me the neck whisperer because she had such a bad neck. She had gone to so many different people. And then finally, with the combination therapy that I used for her, she got a really beautiful neck.
Nice.
But there's also young people who come to me, and I had this client, she looked all over New York City, and finally she found me, and we did a treatment that was effective for her. But she ended up moving to London, and she said, Jordan, I still can't find anyone to do what you did to me. Will you come to London to see me? And I was like, sure. But, you know, with COVID, I haven't been able to. But the neck is a very tricky area. It's very complex. There's a lot going on. There are like a million different treatments that I could do for one neck. And it's scary for practitioners, I think, because of the breathing pipe right there. Yeah. So, yeah. That's the neck.
So do you do like, is there treatments, name of treatments? What would be something that they can go in and ask for by name?
Yeah.
What's the most popular thing for neck?
On my booking website, I do separate my treatments by area. So under the neck section, there's the tech neck prevention, the non-surgical neck lift, turkey neck removal.
So
neck
are you
tightening.
doing also threads in the neck?
I do Botox, threads, PRP, fillers.
Okay.
Yeah, everything.
Very nice.
Yeah.
Okay. Nothing stops
Peels, lasers.
Yeah.
Yeah.
All right. So let's move down to the body.
Okay.
And, you know, everybody wants a sexy body. They all want to look good. And what happens is as we start aging, your body really changes. I experienced that firsthand as I started getting older and older.
Yeah.
So there are many different treatments for the body. Where would you like to start? What would be the next thing for us? Like the décolleté area maybe?
Yeah, we can just start from you know,
there,
up to down. Yeah, the décolleté area. We could also do a breast lift. I've also treated gynecomastia, which is man boobs. I've gotten the fat gone with Kybella.
Nice.
Arm lifts with threads. We can do fillers in the arms for like the cottage cheese texture skin that we get. We can do peels for sunspots, going down into the tummy. If you've had a baby, laxity is an issue. Having a saggy belly button or just loose tummy skin, we could do with fillers or threads. We could do abdominal fat removal, love handle removal.
I think that's probably one of the most popular thing is the love handles. Nobody wants that tire around their waist, right? And
Yeah.
that's what happens when you start turning 40s and 50s. You start, blowing up in the middle area.
Yeah, and you get armpit fat that starts to hang out of your bra.
Yeah, terrible.
Yeah.
Yeah, or the bingo arms where you have flab.
Those are bat wings. Yeah, that flap around.
Do the flap exercise.
Can fly away.
Yes.
Yeah, and it's actually incredible because the surgery available for the arms is not good. You end up having a really bad scar. And the lipo is really hard to heal from with surgery too. You end up being swollen for months.
I think
like
you
at
just
least
need to
6 months.
exercise.
Yeah, but I mean,
so many people want to look good with no pain now. They don't want to exercise. They don't want to put the time in the gym to go and actually work out.
Yeah.
Can I back up? I'm a golfer, so one concern I always have is on your décolleté area when you're out in the sun, you start getting sunspots, and then two, as you get older, you're starting to see the lines in your neck area.
Yes.
That's driving me crazy because that really shows your age when you start having the lines in your neck, like you mentioned, but then you have the lines around the décolleté area. So what are some of the things that you can do? Lasers or?
I don't specialize in lasers, but that is something you can do. Also putting daily sunscreen to prevent that sun damage from occurring, doing seasonal peels to help get rid of the sun damage that's already there, doing threads to help tighten the area and create collagen in areas that have started to kind of deflate and gotten crepey. Also putting voluma or fillers in that area
to like
plump it out. Yeah, and PRP is really good as well.
Yeah. So how long would that last if you did do some plumping up to your area here? How long would that usually last?
It's an area that doesn't really move, whereas like with the lips that moves all the time. So you would probably get about a year or more out of it. Yeah.
Okay. Very good. Okay. And then for the love handles, what would be some things that you can do for that?
So that's fat. So I would treat that with the deoxycholic acid fat burner injection, which is also known as Kybella, and that just gets in there. It's actually a liver enzyme, and it breaks down fat, and it does burn a little bit, but over time it melts away the fat, and it's metabolized through the body, and once it's gone, it's permanently gone. It never comes back.
Nice.
Yeah.
That's great.
Yeah.
So glad there are so many solutions for everything.
Yeah.
So we're moving down. I know one of the popular thing right now is using actually fillers on the hands.
Yes.
And then also everybody wants the
butt.
The butt.
Yes.
So let's talk about the hands
butt
first and then move on to the butt.
Okay. Yeah. So hands are another thing that give away your age whenever your face looks beautiful.
Face, neck, and hands.
Yeah.
Right? Because the rest you can kind of hide.
Yeah. Yeah. So as we age, we lose collagen in our hands too, and they start to get really like veiny and bandy looking. Yeah. I don't know. I'm not trying to put you on the spot, but like such as
it's true.
The bands of our neck, they start to pop out as we age. These are the platysmal bands. The same things in the hands. These bands in the hands start to just pop out, and you can see your veins. And by putting fillers there, it plumps up the hands. It gives you your youth back. Yeah.
I need to come and see you.
I know.
All right. What about the butt?
Butt.
Are you serious? Really? Fillers in the butt?
Yes. Yeah.
Tell me more.
So, I mean, just as you can fill up any area in the body or the face, you can fill up your butt as well. And there are certain types of fillers that are considered biostimulatory fillers. So that means that not only that it fills in the area, it also tells your body to create more of its own collagen on top of the filler. So it's giving you that biostimulatory effect of creating more collagen in the area on its own after the filler is gone. 2 fillers that we use for that area are Radiesse, which is calcium hydroxyapatite. It's similar to bone. And then there's Sculptra, which is the PLLA filler. And both of those can be used in the buttock to shape and sculpt and pop out the butt. And it's a really easy treatment, but it's incredibly expensive. It's comparable.
Because you need a lot of filler.
You actually end up spending more money on this than you do with surgery.
Yeah, so you might as well go get a plastic surgery, unless you need just a, like, is there such a thing as even a little bit of a lift?
Yeah, there's a little bit. So like if you have little, I mean, you can do anything with this, right? Like the possibilities are endless. So if you just need a little bit, it can be appropriate. Also, if you just don't have the time for surgery, like if you don't have the time to heal or the downtime, it's really appropriate. Or if you're hiding it from your husband, you know, you could do it during your lunch break.
Right.
Also,
can you sit right away after you have?
So you're supposed to not sit immediately after the procedure, which is
you
the
better
hard
not
part.
be driving back.
Yeah, if
to
you're
wherever.
if you're on your ass all day, it's an issue. Yeah,
funny.
but it's a really easy procedure to go through for the patient. It's not painful, and also the downtime is so easy. But you do end up spending more money on that procedure than you would for an actual surgery. But the actual surgery is very dangerous.
Yeah. Oh, yeah.
Yeah, you can actually, there are higher cases of death with the surgery, the BBL
butt lift,
surgery.
the Brazilian butt lift.
Yeah, because the fat can get stuck in a vessel and then cause an embolism and immediate death.
Terrible.
Yeah. So.
Well, actually, there is actually one of our clients is coming on to Meet the Expert, and he's actually a specialist in Brazilian butt lifts in Atlanta, and he does like so many, and it just amazes me how many people actually go and have that procedure.
Yeah, I actually had the procedure.
You did?
Yeah, I did. I'm telling you, I'm pro.
Too many secrets
I'm pro
here.
surgery. Like,
you're so funny.
Yeah, if I had a client, I'd be like, just go get surgery.
Go get it done.
It's more affordable, but I do understand that there are fears with surgery, the anesthesia, the downtime. Sometimes it does make sense to not have surgery, but I'm pro. Go do it.
Yeah. Well, whatever it takes to have you look the best. So you have invasive, you have non-invasive. So whatever it is, your wish is your guys' command now, right? Whether it's you, non-invasive, or a plastic surgeon, you can basically sculpt the body that you want now.
Yeah, we totally can. The possibilities are endless.
They are endless. Very good. All right. What else would you like? Is there any other tips or secrets that you want to share with our audience to help them look their very best?
I'd say just a little goes a long way. And if this stuff is scary to you or overwhelming to you, that just doing a little tiny bit will be worth
steps.
It. Yeah, whether it be just a little bit of Botox or, you know, changing your skincare regimen or starting peels seasonally, it will add up and you will see the difference in the years to come. You'll actually end up looking better in the future than you do right now.
Yes.
And you'll feel more self-confident. You'll show up a better person.
Yeah.
It's really worth it.
Yeah. Because at the end of the day, when you look in the mirror, what you see, that reflection back at you, makes your mood, right? It creates your
it's a positive
attitude.
It's a positive feedback mechanism. A lot of people think that, you know, if they look better, they'll feel better, but it also works the opposite way too. When you feel better, you look better. So there are certain hormones that we release when we feel confident and we look good, and it just elates us on all different realms.
Yeah. It gives you that positive aura that people can feel your energy, right?
Yes.
And you attract better quality people to you.
Yeah.
Really, it's all connected.
It is.
All connected.
It is. It all matters. Yeah. It's a form of investing in yourself. Yeah.
So Jordan, before I let you go, we have to give people some insight on what your book is going to provide consumers. I love the title. How did you come up with that? It's so good. That's a great idea. I love the title.
So on my Instagram, it's part of my name is I poking people pretty in New York City.
Yeah. Oh, I love it. Poking people pretty in New York City.
Yeah.
Love
yeah.
that. Okay.
Yeah, so it's a little joke that I have with
Yeah,
my clients
I
that I'm
love
poking
it.
them pretty.
Yeah.
But the book is about the treatments that I offer because it can be overwhelming and there's probably over 100 treatments that I have to offer. So it kind of simplifies it and makes it understandable for the client so that they can come in with more knowledge and know what questions to ask and have an idea of what to expect with each treatment and how much it costs and how long it lasts, all those things.
Very nice. So it prepares them to and provides them with different options that they can actually have a lot of what we talked about, but a little bit more, assuming in depth. That's wonderful.
Yeah.
I think we need more people like you publishing books like that so we can educate the audience, meet the experts audience, and other people all over on what they really need to know before they actually trust someone to their face or their body and everything else that they're going through. So I'm so excited for you in putting out the book.
Thank you. Yeah, it's like a little encyclopedia for them.
Very nice. Well, good. And one other thing, as we were talking right before the show, well, we found out that you and I have the exact same birthday.
Yeah, we do.
I have to say, I have never met anybody else that has my same birthday. And it got me thinking, like, how many people really are born on every person's birthday?
Yeah.
And then to meet them, right?
Yeah.
It's probably so amazing. So that's nice that we share that. And I loved having you on the show and having you share your wisdom and knowledge and expertise with everyone else. Thank you so much for being with us.
Yeah, and just to let the listeners know, we're October 3rd. That's Libra season.
That's right,
and
Libra.
October 3rd is the day of trendsetters.
There you go. That's what we are right here. We're trendy people.
I do little... On my stories, I have a birthday book that I pull out and I ask my followers to message me their birthday and I'll read their birthdays for them. So it's kind of a little special thing.
Oh, I like that. You have to share that book with me.
Yeah, I will.
Well, maybe we'll put it under the video so they can actually get it.
Yeah.
And also under the video, I would love for you to share how someone would reach out to you. What's the best way to reach you?
So social media, my handle is Genuine Injector with a G, Genuine Injector. Also YouTube, TikTok, Facebook, it's all Genuine Injector.
Nice.
And then my website is jordanjacobsnyc.com.
Nice.
Yeah.
And I love your name too.
Thank you. Yes. And you can email me at jordan@jordanjacobsnyc.com. I also offer a mastery class for practitioners.
Nice.
And yeah.
Yeah. So you just do it all.
Yes. I'm working on an online learning platform right now too.
Very nice.
To help teach medical professionals
how to
be better. Yeah.
Oh, that's wonderful. Well, you continue your entrepreneurial path here. So you're diversifying and you're helping more and more people, not just consumers, but your next big thing is to actually help other people become better also at what they do.
Yeah, my real passion is in education. I think that's lacking in our industry. So it's my dream to travel around the world internationally and teach.
Well, I'll be following you around. Maybe we'll celebrate our birthday in Fiji.
I would love that. Yeah, let's do it.
That sounds great. Well, thank you so much, all of you, for joining us. Thank you, Jordan, for being with us on Meet the Experts. It's been truly a pleasure and honor to have you with us. Like this episode, make sure you give us a thumbs up, share it with others. We would love to build a bigger audience for the Meet the Experts. Make sure you ring the notification bell so you can get notified every time we bring a new expert to help you navigate through the whole med spa, anti-aging, health and wellness and beauty arena. So you can always look your very best and feel your very best. Thank you so much for joining us, and be well and be healthy. Thank you.